Good morning. Welcome to the Veterinary Technician 101 video conference. Thank you for joining us this morning. This video conference is brought to you by the Emma Barnsley Foundation and the PEER program at the Texas A&M Veterinary Medicine and Biomedical Sciences College. Today we're going to have 3 different technicians talking to you about the world of veterinary science and their role in it. We'll have Juan, Linda, and Paula, and they each play a different and unique role at the Small Animal Hospital at the Texas A&M College of Veterinary Medicine. So to begin today, we'll have Juan come up and tell us a little about himself and what he is currently doing in the field of veterinary science. Thank you.
Alright, everybody hear me? My name is Juan Torres. I graduated in 2011 from Texas A&M with a degree in biomedical science. After I graduated, I applied to vet school, and unfortunately I didn't get in, but I decided I was debating if I was going to reapply again. So the only thing that I had to do was get my grades up. So I was thinking of going to graduate school, get my grades up, but I just kind of had to look myself in the mirror and just kind of face that maybe I just didn't want to do it. I just didn't see myself down the road being a veterinarian. But I knew, working as a technician for 3 or 4 years before, I loved doing that, and I figured out that maybe that's what I always wanted to do instead, because I've always wanted to work with animals. I knew that my entire life. So when I heard that Lynn, the community college here, had a veterinary technician program that just opened, I applied that summer and I got in, and that's kind of where I am today. I'm in currently my second year, my last year, and hopefully to graduate in May. And I work at the Texas A&M Veterinary Hospital right now as a student worker. I work in orthopedics and soft tissue. Orthopedics, we do a lot of leg surgeries, a lot of broken bones, fractures like that. And soft tissue, you think of dog wounds, dog fights, or just kind of gashes, anything like that. We just kind of work with getting them back together and hopefully sending them home to their happy owner. But I love what I do. I loved it the second I started. And that's kind of what helped me make my decision and choose to continue with it. So, thank you. So, here we go. All right, so veterinary technicians. All right.
It takes a second.
Okay. So who we are. So veterinary technicians work under the supervision of a licensed veterinarian to treat or help veterinarians diagnose the illnesses or injuries of animals. Now, as technicians, what our job is, we help the veterinarians. We can't diagnose ourselves, but we assist the veterinarians in diagnostics and running tests and running blood and helping them find out what's going on with the animal. So a little funny kind of picture that kind of has different views of from everybody of what we do. My friends think I do things is we just play with animals all day, which is kind of true. My parents think I do. They think I'm in surgery, and which we don't actually do the surgery, but we do help in surgery, so it's technically not that incorrect. What society thinks I do, clean kennels. Unfortunately, it's sometimes what we do, but it's more than that. My clients think I do. They don't think we do anything. What I think I do, this is pretty spot on, and what I really do. So I say all these different views are a good representation. So we obtain and record patient case histories. Excuse me. This basically, whenever a client comes into the hospital, it's our job to get a history on it and just summarize what's going on with them. What their diet's been like, if they've had any trouble like that before. Pretty much whenever you go to a hospital and you try to, they ask you have you ever been sick before? Have you ever had symptoms like this? We do that the exact same way. Collect specimens to perform laboratory procedures. Again, like I said before, we collect blood, we'll collect urine, maybe fecal material, we'll have to run tests and see if we can find anything, and we'll consult with a veterinarian. Provide specialized nursing care, such as, if for orthopedics, for example, whenever a dog finishes having surgery, we'll have to go and make sure we're getting their pain medications, we'll have to ice pack their leg where they got a surgery on, stuff like that. Prepare animals, instruments, and equipment for surgery. We have to get everything prepared. We have to get the animal induced, knock them out, and clip them up and shave them, get them ready for the surgery, and make sure all the instruments are sterilized. Assist in diagnostic, medical, and surgical procedures. Things like getting x-rays, ultrasound, things like that. Again, whenever you think of different procedures that you do, whenever you go to the hospital, we'll do the exact same things. Expose and develop x-rays, pretty straightforward. Supervise and train. Oh, I'm sorry, I got a little ahead of myself. and supervise and train practice personnel, and stock and maintain medicines and supplies. That's a pretty big portion of what we do, to make sure that everything is stocked. We have all the supplies and materials that we ever need, and make sure that nothing ever runs out, because the second something runs out and you're having a busy day, it doesn't really go well. Education requirements. So again, like I said, I'm a second year right now, so it's a 2 years associate degree in veterinary technology, and I'm hoping to finish up, and I cannot be waiting to finish. 191 veterinary technology programs accredited by the American Veterinary Medical Association. The blend program, which I'm in right now, we just got our accreditation, I believe, this past summer, so that's really good news for me. Veterinary technician national exam, which you pass to become a licensed veterinary technician. You have to take the Texas State regulatory examination, but for different states, it will be, a Kansas State regulatory examination. That's more along the lines of kind of the bylaws and the government portion of it. Once you pass that, you become a registered veterinary technician. And career outlook. So employment is expected to grow by 52% by the end of the decade, which means there are going to be a lot of jobs opening up. So that's good news, again, for everybody, especially nowadays. Veterinary technicians is in the top 10 of growing occupations in the country. There's an increased demand to support public health, food and animal safety, natural disease control programs, and biomedical research. There's all these kind of different fields. So being a veterinary technician doesn't mean you're restricted to just working in a hospital. There's many different fields that you can work in that I didn't even know about until I entered veterinary technician school. Field. So again, small and large animal clinics. You can work with exotic and zoo animals. We have an exotics area in our hospital, and I've seen probably lions, cougars, you name it, we've probably seen it. Research and laboratory setting, which is a really big portion of it, and people don't think about it. Anytime we do research, anytime you take a medicine, anything like that, that research has come from working with animals. It's research on animals. So without this, you wouldn't have medicines, and we wouldn't have, a lot of things that we have today to help us. Educational setting, again, I work at the Veterinary Technician Hospital, so we teach fourth years. We'll educate a bunch of people. I'm hopefully educating you guys. So, animal shelter or rescue organizations, disaster and emergency response. This is a really important thing that we do, and again, the hospital kind of recently opened up their own veterinary emergency response team, which technicians and doctors are all a part of this. So anytime there's a hurricane or a flood or anything kind of natural disaster that happens, they'll be sent out to that area, wherever it may be, and they'll assist with all the animals that need the help around there. I think a few months ago we had a lot of forest fires at that shop around here. And they were called over there to help all the animals, a lot of lost animals, a lot of cats, dogs, a lot of cows, things like that. They had to go see all these animals and have to help them out and do surgery and do the best that they can do. And it's hard to do. I really respect them for what they do, but it's really worth it also. And food safety, you want to make sure what you're eating is good. You don't want to get sick, so you get to do tests on them and make sure everything works well. And specialization. So along with being a veterinary technician, you can also specialize in a certain field, whether it be, like I said, anesthesia, surgical, internal medicine, dental, emergency and critical care, behavior, zoo, equine, clinical practice, and nutrition. So after graduating, if I chose to, I could try to go into school again and try to specialize in something like that. For me, I'd probably want to specialize in surgery or something like that. Okay, and that is it for my portion. So I'm going to pass it over to Linda, who again works at the hospital with me, and I worked with her I think probably the past 3 years, and she's also very smart in what she does, and I've learned a lot from her. So.
Good morning, my name is Linda Knight, and I have been in the field for about, probably a good 20 years. I first did volunteer work, and I worked at a clinic. It was mixed practice. It was small and large. I knew nothing about large animals, so I kept my distance. Then I decided to go to school. After I went to school, for 2 years, I did a preceptorship, and then I worked at A&M. And I've been at A&M since the last 12 years. I've worked in radiology.
Go ahead. You can go ahead.
After working in radiology for 12 years and ultrasound, I decided to go ahead and become a radiation therapist. We examine the machines to ensure they are safe and working properly. We explain treatment plans to clients and answer any questions that they may have. We follow procedures to protect the patient and myself for overexposure. We check the computer programs to make sure the correct dose of radiation is given to the correct area of the patient's body. And as you can see, jumped ahead again. Our first patient, one of our first patients was a horse. We just finished, we did 4 treatments on him. It was quite exciting to do this horse. It was a challenge for everybody that was involved because trying to get the horse loaded onto this table here and then maneuvering it into the control room where we did the radiation, and it was lots of work, but at the same time, lots of fun. As far as I know, the patient is doing well. He's been done for at least a good 2 weeks, and the tumor is starting to regress. So it's good news for him. We have happy endings, and we do have some sad endings, but I like to think about the happy endings. We operate the equipment to treat patients with radiation. We monitor the patient to check for unusual reactions to the treatment, keep detailed records of each treatment. The 2 pictures that you see here, if you can see that there is a lighter area in the middle that looks like a circle, that is the tumor. And with the program that we have, which is called Velocity, we will go in and outline the tumor that the dog or patient has, the cat or the horse. So each area, the purple color is the brain, and then the tumor is the red part, and we go through each slices. So there can be 100 slices for each patient, and we'll go through them and outline each slice in there. So we will make sure that we contour each slice so that we can treat, and that is what the animal is being treated for. So before we do all this, we'll do a CT, which just gives us detailed information about where the tumor's at, how big is it. Then we'll go in and we will do the contouring as you saw earlier, and then we'll go ahead and treat. Usually it surrounds the target with high precision radiation delivered from all angles, minimizing radiation exposure to healthy tissues, and we adopt the treatment plan to any point. Tomotherapy. It's a unique design, allows treatment to be delivered continuously from all angles around the patient. More beam directions give physicians more control in planning treatment. Dose is better conformed to the tumor, reducing the risk of short and long-term side effects. So our patient right there is, his name is Bo. And he had a oral melanoma, which is a tumor that is in the mouth. And he is positioned in this device that we call a bite plate. And he is anesthetized, and the radiation, he's being treated for his oral melanoma tumor. And now I am going to pass it over to Paula.
Hi, my name is Paula Plumber, and I have been in the veterinary field for approximately 15 years. I've been a registered veterinary technician for probably 12 or 13 of that. When you've been in the field so long, you kind of forget how long you've been in what. I went to school in Oklahoma and got my associates in applied science there, and then took my national and state test and passed and got my veterinary technician certification. I worked in Oklahoma at the Oklahoma State Vet School for about 3 or 4 years. I worked there in both the community practice, and there I taught students how to give vaccines and do general wellness exams. And then I switched over to the intensive care unit for small animals and worked there for about another 3 years. I then moved to Texas and got my Texas license. And while I've been here in Texas, I've worked in both general practice and in the university setting. I found that I liked the university setting better because I could help teach students, and it gave me more opportunities as a veterinary technician. I've also in that time found out that I absolutely love to teach, and there's not a lot of time to do that in a general practice. So that's one reason why I stayed in the university setting so long. I worked in the critical care unit here at A&M for a long time, for 3.5 or 4 years. And while I was there, I obtained my veterinary technician specialty in emergency and critical care. That's a very long process, and it's really hard. You have to study a lot and go through an extravagant application process. But it's really worth it because your knowledge base is so much better. You can help your patients a lot more than just with your veterinary technician degree. And at that time, I got tired of working nights, so I switched to the feline internal medicine department. And in that department, I help students learn about cats, teach them every aspect and everything that they need to know with cats, from restraining them to doing generalized procedures on them that they need to have done to get better to go back home. The reason why I became a veterinary technician was truly because I love to help animals, and because I just want to help them feel better and be back home with their families. And so many people told me that that was not the right reason to go into the field. So I encourage you that if that's truly the reason why you want to go into the field, then stick to your guns and stick up for yourself, because I've had a long, happy career, and I have still many years left to go. And I truly did it because I love animals. So just to give you an idea of what I do every day, I assist with all the appointments in the feline internal medicine department. And our department's kind of weird because even though it's feline internal medicine, we do see dogs every once in a while. So about 30% of our caseload is dogs and about 70% is cats. I also make sure that all of my patients are doing well. All the hospitalized patients, I come in early every morning and help the students and the doctors get organized for the day and make sure that all of our patients have the appropriate samples drawn and the students can get their exams done. So I just help in any way that I can in the mornings. Any type of nursing care that needs to be done, I do. What that means is just making sure that the patient is comfortable, making sure that their bedding is dry, that they have a clean environment. It's very important for cats to be quiet and happy when they're in the hospital for them to get better. So I just try to help facilitate that. And then again, I help teach the veterinary students throughout the day with any procedures or any tasks that they need to do with their patients. And that can be anything from drawing blood or obtaining urine samples or putting in feeding tubes or anything like that. And then a really fun aspect of my job is I get to assist with endoscopies. And all that is like in human medicine, they take the big long tube with the camera on the end, and our patient is anesthetized, and we just go down and look at whatever we need to look at, whether it could be the stomach or the esophagus or any portion of the small intestines. We do all of that, and you can get biopsies and help your doctor get your diagnosis from the endoscopy. So I kind of jumped ahead and covered this a little bit, but like I said, I help with sample collection, which is venipuncture. So I help the students learn how to draw blood. Cystosynthesis is where we take a needle and stick it into their bladder to obtain a sterile sample, and that can help with diagnosis as well. And then I assist in procedures such as feeding tubes. And that picture of the cat there is a patient with a feeding tube, and that's a picture of somebody feeding it through the feeding tube. So if the patients aren't eating on their own willingly when they're sick, which a lot of times they don't, then we can place a feeding tube in them and help get them nutrition while they're sick. I also help with joint taps. So just like if you were to go to a doctor and get a joint tapped on yourself, we do the same thing on animals if that's what we need to help us get the diagnosis and make the animal feel better. Abdominal synthesis is where we obtain a sample through the abdomen. So you can actually just put a needle sterilely into the abdomen and withdraw fluid to help them feel better or to help get a diagnosis. And a thoracocentesis is the exact same thing, but you do it on a lung or on the chest instead of on the abdomen. So just to talk a minute about my time whenever I was in the intensive care unit. Patient care is a huge part of being an ICU technician. So if that's what you want to do, if you want to spend a lot of time beside the cage of a patient and help them get better, and you like critical care things and help making really sick dogs or cats feel better, then ICU might be the way that you want to go. That's a picture of me sitting in front of a dog that was hooked up to, I don't know, I think there's about 6 or 7 pumps and a full monitor to monitor his heart and his blood pressure and a couple of other things. And if you can tell in the picture, he's got his abdomen wrapped, and he had a drainage tube in his abdomen because he had been hit by a car. So I spent probably about 80 hours in front of that dog's cage that 2 weeks that he was in the hospital with us, just making sure that he felt better and he got the proper care. That other picture on the right is a picture of me with the dog that came into the critical care unit, and he had been shot by an arrow. And you can see the arrow sticking out of his chest. And luckily, the arrow did not hit anything important, so it didn't hit the lungs or the heart. So we got the patient stabilized and rushed him off to surgery, and they removed that arrow, and the dog actually went home in probably about 48 hours. So that's a happy ending for that patient. Another aspect of veterinary medicine that you can be a part of is blood donors. Lots of people don't realize that dogs and cats can be blood donors just like people can. And some practices have their own blood donor program. We have our own blood donor program at Texas A&M. We have people that volunteer their dogs and their cats to come in and donate blood. They have to go through a testing process and get their blood types just like people do. Dogs have 11 different blood types, and cats have 3 different blood types. And you have to go through a process and get your animal blood typed and make sure that they don't have any type of diseases, that they're just generally healthy, and then they can be in the program. And the way that it works at Texas A&M is that you're on an on-call basis, and if there's a patient that needs a blood transfusion, then they call you in as an owner, and your dog or cat donates a unit of blood and helps that patient recover from their illness. I have both ran a blood donor program and am an owner of a blood donor. So you can do both, or you can do one or the other. Whatever your interest is, you can kind of fulfill that with blood donors. They usually will help keep the pets they'll usually keep a steady supply of blood and the different components of blood on hand for any type of emergency.
Okay, at this point, we have a class of students in here in the studio with us, and we're going to open it up to them first and see if you guys in here have any questions for the text. And if Linda and Juan, if y'all can come up too. Okay, y'all might have to scooch down this. There you go. All right, so you guys have questions for them in here? Okay, Laura?
Where do you find the information to join the blood donor program?
Okay, that's a good question. The question is, where do you find the information to join a blood donor program?
To join the blood donor program at Texas A&M, I think it's on the website for the vet school. There should be a link on there, and this is for local people only, obviously. But if you are interested in having your dog or cat as a blood donor, you might call around to your local veterinarian or your local vet clinic and see if they have a program that your pet could be a part of.
Okay, that's a great question. We have another question in here? Yes, ma'am.
What is the difference in the pay between a veterinarian and a vet technician?
Okay, great question. What's the difference in pay between a veterinarian and a veterinary technician?
I think I read the average salary of a registered veterinary technician is like $32,000. That's the average nationwide. So your experience level and where you live will determine if it's higher or lower than that. Do either one of you guys know what a vet makes?
I mean, I think I've a few vet students that graduated that I've seen work. I think some start out maybe like at $58,000, stuff like that. But again, it just ranges like economically. Like a vet here is going to make less than a vet like say Houston or New York. Again, it's just like kind of the price of living that is associated with it, so it kind of just averages out.
And is it true? I know for veterinarians, the more specialized the veterinarian is, the higher that their salary is. Right. So they might start off at $60,000 for general large animal practice. Right. $80,000 for a small animal clinic, and then if they're a specialist, they can. Right. The sky's kind of the limit. Is it the same with veterinary technicians?
Yes. Yes.
Mm-hmm. Yeah. So again, like with veterinarians, if they want to specialize in a certain area, they'll do an internship at residency, which I guess is basically another 4 years of kind of school, but they'll do more hands-on things, and then they'll get their residency after they pass boards, and they'll find a job somewhere. So there, the salary can go up. Probably significantly, but I guess it's the same thing for a technician as well.
Okay. Kind of related to that, what's the progression? So I know a lot of the high school kids that are students that are watching this are in veterinary assistant programs. Mm-hmm. What's the progression from veterinary assistant, veterinary technician, and how does that rate to veterinary medicine, being a veterinarian?
I mean, well, veterinary technician and veterinarian, I guess, are kind of just two different aspects. They both this is animals, but they have like a veterinary technician has their own program, and like a veterinarian has its own program as well, like 4 years compared to 2 years. I don't really know actually a lot about the veterinary assistant programs that's going on in the high schools, which I had known about when I was in high school.
I know a lot of people say they wish it was going on. I think it's kind of a introductory step. So you can be a veterinary assistant, then you can go in high school or without college. To be a veterinary technician, you have to go to at least 2 years of college, correct?
Okay. I know if you want more information about the certification, I think they're calling it CVA, you can go to TexasVeterinaryMedicalAssociation.org, so tvma.org, and I think you can find all the information on there.
Okay, great. We have another question in here from the classroom. Yes, ma'am?
Okay, how many hours do y'all work a week? Like, do y'all have to work odd hours on call?
Oh, great question. The question is, how many hours do the veterinary technicians work per week, and do they work night and on call?
So obviously if you work in ICU and stuff like that, they'll be on call, and you'll have to do night shifts and things like that. I'm a student worker right now, so I can only work around my schedule, but whenever I start working at the hospital full time, I'll work a 40-hour week, unless I do overtime and things like that. But it also depends on, whenever you just get out of surgery that day. Sometimes you'll get out at 7, sometimes you get out at 9, sometimes you finish at 5 or 4 if it's early. But yeah, for ICUs and just emergencies, there is on call. There are like night shifts also.
Just depends on where you work.
Yeah.
Right, depends where you work.
One more question from in here, I thought. Yes, ma'am.
What is put into a feeding tube?
What is put into a feeding tube? Great question.
So it's just food, canned dog or cat food that you take and you mix with water and you put in a blender to blend it up and make it like a slurry, and then it will run through the feeding tube, and you can just pull it up in a syringe and feed it to the dog or cat that way.
Okay, that's interesting. Well, we're ready to open the mics for our interactive sites. If you would like to open your mic and ask a question, be sure to ask it loudly so we can hear it, and then I'll repeat it for the veterinary technicians. Do we have somebody out there that would like to ask a question? You can open your mic and ask a question.
Yeah, we have a question.
Okay.
This is for all three of the vets there, and it was a really neat presentation, but what was one of the most bizarre animal cases that you ever got to participate with?
Okay, great question. Most bizarre or exciting animal case? Okay.
For me, probably my most bizarre case was I did CPR on a snake once.
So, and did the snake make it?
No, unfortunately.
Oh God! And what was that like? Were you a little bit hesitant?
I wasn't really hesitant, but it was just a little bit different because their anatomy is different from a dog and a cat. So we had to get a little bit inventive, and it was a small snake. He was only about that long, so everything was a lot smaller, and we didn't really have the super tiny equipment to really do a very good job. I guess that's probably why he didn't make it, but we tried.
And I'm guessing this was not a poisonous snake.
No, I think it was like a ball python or something like that.
A ball python. Interesting. Linda, how about you?
I've had lots of encounters with different animals working in radiology and ultrasound. The first one that just comes to mind right now is actually having to ultrasound a sloth. The anatomy was quite different, so that was quite interesting.
And was the sloth cooperative, or what was
we
the?
We had to sedate the sloth. So
that was interesting. Juan, how about you?
All right, so I'll say I work in small animal like orthopedics, so I work with just dogs and cats mainly. But one time we had a guy come in with a pot-bellied pig who had a fracture. So we had to do what's called an external fixator, which is pretty much you kind of fix the bone from the outside, and they'll have like kind of rings of metal and just kind of pins sticking through the legs to kind of like hold it stable. So it was just the weirdest thing. We had to like prep this leg, and it was just like fake pig hair, and we had to do pig aftercare, and we knew nothing about pigs, and it was just a pig hanging around in orthopedics, which is not really seen, and it was just kind of awkward.
But that's definitely a pet, right? This was a family.
It's a family pet, yeah. It was a legitimate family pet.
And people have all sorts of pets, and I think one thing you guys can probably say is you've learned to appreciate just about every species and every kind of pet that the people could have. That's a fantastic question. Do we have another question from out in the interactive sites? Would anybody else like to open their mic and ask a question, or same school if you'd like to ask another question?
Yeah, we have another question here in Wisconsin, so I'm gonna let the gal go ahead and answer it, right, or ask the question. There she is.
What
Go ahead.
classes are you looking at in high school if I want to go to be a large animal vet?
Her question again is, what classes should she be doing in high school if she wants to go to be a large animal vet?
I'm honestly not really sure because nothing that you guys have right now was invented when I was in high school. But I can tell you to make sure and keep your grades up because getting into vet school is extremely hard and your GPA matters a lot.
I agree.
Yeah, it's pretty good.
Most of the time when we have veterinary students that are here, one of the things they say is make sure you take math and science. And that's important for your foundation to go on into your undergraduate in college. And then it is important as you go into veterinary school. And the math and science and your grades in math and science are very important as you go on. And another thing the veterinary students say is if you're interested in being a veterinarian is to be well-rounded. So even at your young age, even when you're in high school or middle school, if there's some students listening in middle school, try to get out and get some experience, not just with animals, with other stuff too. They look at a lot of stuff like maybe you've worked at a clinic, maybe you've worked in a therapeutic riding program, Maybe you've been on a soccer team and you've learned teamwork, or maybe you're in a marching band. All those kind of things show what kind of a well-rounded person you are, in addition to keeping up your grades. And most of the veterinary students will say that that was the key to them getting into vet school and preparing for vet school.
Yeah, I think experience is a big part of it. And for the girl who wanted to do like equine, just if you can find like a farm or just anywhere you can start volunteering or working with horses and stuff like that, the sooner you get started, the better. Because part of getting into vet school is like also having animal and veterinary experience. So those are going to help you out tremendously in the future.
And a lot of times they say, I know I was one of the cases where I grew up loving animals, thinking I wanted to be a veterinarian, and then I worked in a veterinary clinic and realized I really didn't like working with sick animals. So it's good to get that veterinary clinic experience to find out, is that really what you want to do? Because there's other things to do. You could be a veterinary assistant or a veterinary technician, or you could be an animal caretaker, or you could be an animal trainer. There's a lot of careers out there with animals, but getting that veterinary clinic experience, I think, is very important. Okay, great questions. We probably have time for one or two more. Do you guys have another one?
Okay, I have a great question here, and it involves small animal versus large animal. What are you seeing the trend? What are you seeing the trend now at Texas A&M with students going into the small animal world versus the large animal care? Where are there more job opportunities, and where is the money?
That is a great question. Do y'all have some comments on that?
I would say a lot of job opportunities, I think, probably are large animal. That's also probably where the money is, though, I guess. I mean, specialty clinics, again, if you want to specialize and do small animal like surgery or anything like that, you can also get good money doing that. But jobs right off the back, people starting off, it's going to be large animal, because there's a lot of large animal, food animal work that needs to be done. Not a lot of people go for it. So I think that's probably where the jobs would be.
I would not go into veterinary medicine for the money. You work hard and you do it because you love it, not because of the money. Yeah. It's not that the money is bad or awful, but if you are wanting a job that you're going to be rich, veterinary medicine is not that career field. There's lots of other career fields to go out that will make you more money. But as a rewarding profession, veterinary medicine is very rewarding.
As far as trends go, from what I've heard from the professors at A&M, there is a lot more students wanting to go into small animal and pets than there is students wanting to go into large animal, particularly food animal. And students that come in wanting to go into food animal, and that's, cattle, sheep, hogs, they're rare and they're very valued. So if that's something that you're interested in, that you'd be quite attractive to the people that are interviewing and trying to get into vet school, because there's a great need. A lot of the food animal veterinarians that are out in the field are coming to the age where they might be retiring, and we're going to need to be replacing them, and so they're looking for food animal. Now, of course, the food animal job, that's a really tough job. That's out in the field with cattle and hogs and sheep, and it does take a special kind of person, and like they're saying, a special type of dedication to do that. I think what I've heard is that small animal practices, especially surgical practices in big cities, tend to be the ones that make the most money. Is that...
Yes.
So small animal practices in large cities tend to make the most money, and there's also a need for those too. We went all over Texas last summer visiting veterinarians, and especially in the rural areas, that they really need qualified people like you guys to go out into the field and work out in those rural areas. So there's a great need for that out in the rural areas in the state. And by the way, we're so excited to have Wisconsin talking to us. We're very excited when we heard that you guys were in Wisconsin. So, okay, we probably have time for, what do you think, one more question? One more question?
We had a question.
Go ahead.
Had to leave. Well, our class had to get up and leave, but we had 2 actual veterinary techs in the class, and they wondered if, when you said you did CPR on a snake, you did chest compressions or mouth to mouth.
Great question.
We did chest compressions, and I actually took a peripheral IV catheter and used it as an endotracheal tube and hooked up an adapter to the end of my oxygen tank and gave them oxygen that way.
Wow. Okay, we probably have time for one more question. One last question. Anybody have a burning question? Do we have anybody in the classroom that would like to ask one last question? Yes, ma'am.
And I want to put you on the spot. You have this really cool board here with you talking about some of the aspects of your position. And if you could just go through quickly and tell us what's going on in these different images.
Here I'm just running a few tests on the machine, and I'm looking at the lasers. So on each wall we have about 4 lasers. So on this wall here, you can barely see, we have 2 lasers. On the opposite wall there's another 2 lasers, and then on top of the roof there's a couple of lasers. And then in the back of the board there is another laser as well. So I'm just running a test right now which just calibrates to see what the dose is with the machine, how much radiation is being produced by the machine. And we do this on a daily basis. And then after we do the test on the machine, we'll go ahead and start treating our patients, because we'll make sure that the machine is working properly before we start using the machine. And then on this picture here, we have a patient that we have in a bite plate, which what I was just talking about earlier, is that we make a mold, so it's kind of dent. So whenever you go to the dentist and they make a mold of your teeth, it's basically the same thing what we're doing for this patient right here. This is a mattress, and this just holds them in position, as well as this device right here, and then we send them into the bore, which is this circle right here, which you can barely see. But they go in, and that's where they're getting radiated from that point. And then here, when we do our contours, we are outlining, basically like doing little dots on the patient, and we're outlining where the tumor is at. So right here is the brain, and then we have the skin, which is going to be outlined, and then this will be the bones. And then right over here we'll also have the tumor, where the tumor is being located at, and that's what he's going to be treated for. And here we're just running him in where the veterinary student is monitoring anesthesia and making sure that the patient is doing well under anesthesia.
Okay. Great, thank you. Okay. Okay, well, we'd like to thank you guys for being here. We're going to tell you a little bit about the peer program, but let's give the guys a round of applause for we appreciate it.
Yeah. Thank you very much for being here, and thank you for our remote sites for coming and joining us today as well. Now, if you'd like to know a little bit more about what veterinary technicians do, if you'd like to see some of the procedures they have, then you can visit our website, which is peer.tamu.edu. I'm going the wrong way. It's my fault. My fault. Okay, so you'll be able to see quite a few more activities and videos and all kinds of things that will give you.
I'll stop now.
We'll give you some more information. So you'll see here that we have not only lessons, which includes full lesson plans and activities, labs that are quick and easy. A lot of our ag science teachers don't have full laboratory setups, so these are what we call kitchen laboratory experiments or laboratory experiments on a budget. So you'll see those at the top where you see the modules on neutering, parasites, vaccination, physical exams, nutrition and growth. You can find out all kinds of great lessons and activities there. And underneath you'll see veterinary technician videos. Some of the veterinary technicians from our small animal and large animal clinics here at Texas A&M University volunteered to be videotaped while they did various procedures, such as fecal exams or cystosynthesis, or all different types of responsibilities, duties they have in the clinic. So you can see how they do that. They not only let us watch them do it, but they also describe the process as they went. So it's kind of a step-by-step process of what's going on. Now, in this screenshot, you can't see it, but if you go to the actual website, again, that's peer.tamu.edu. If you scroll down that same page, you'll see some teacher-requested resources. You have the opportunity as a teacher to write into us and ask us for a lesson plan, and we'll put that together for you. Now, on that website, there are quite a few lessons that have already been created by teacher requests, so things that might be really beneficial to your classroom as well. And that includes things like livestock production, urinalysis, diagnostic testing, imaging, all those things are there as well. And this is the agriculture science site. But you can also see This is the main page, so when you go to the website, and you'll see the website there again, you'll see in the bottom corner the Ag Science materials. That's where you're going to click. All right, thank you again for joining us today, and we hope to see you soon.